नहीं है? ओके, डॉक्टर स्वानंद गोलक.
अच्छा, you do 13. Okay. Well, all the respected chairpersons and the consultants, very good afternoon. Today I would like to talk on cognition and CBT in vertigo. Before starting my topic, I would like to convey my regards to my teachers in the otoneurology, Dr. Anirban Biswas from Kolkata and Dr. Milind Kirtane from Mumbai. It's not going forward. Not moving. Yeah. Well, dizziness is often a feeling of being unsure about your place in space. It could be physical or emotional. Sometimes life's uncertainties manifest in unexpected ways, and that's where the mind and the body intersect. So, today topic is cognition, what it is. Cognition is a thought process. It is the highest level of mental information processing in the brain. It consists of first acquiring knowledge through sense of smell, sight, sound, touch, taste, and balance, and then using the acquired knowledge to achieve a desired goal. Past experiences stored in the memory are retrieved to contemplate what the future could be and what could be the consequences of action, and accordingly the action is executed. This entire process is cognition. Compositions of the cognition are perception, memory, attention, reasoning or judgment, and problem solving and execution of the action. Understanding of ongoing reality through visual, proprioceptive, and vestibular sense, this is perception. Establishing coherence between these different sensory inputs and comparing with previously stored experiences, this is integration and memory recall, and integrating the inputs of brain to comprehend the reality about the stability of the ground and surroundings with memorization of the experience, this is reasoning and judgment. Executing a motor action based on integrated inputs to maintain stability and prevention of fall, this is execution of programmed response. Now, maintenance of the balance involves adaptation to the ongoing reality and storing the brain the experiences learned pertaining to the maintenance of the balance and retrieving the information immediately when required. Prediction of the expected challenges to stability by comparing with the previously stored experiences, and innovation of newer strategies to maintain balance with the similar experiences which are not stored in the brain or when contradictory inputs are received in the brain. Cognitive powers. They are different in different individuals and different health and diseases. The limbic system, the hypothalamus, and amygdala are the areas of the brain involved in cognition. These are of great importance in maintenance of the balance as well as development of vestibular compensation. Vestibular disorders patients experience deficit in cognitive skills like short-term memory, topokinetic memory, mental concentration, arithmetic, reading, and multitasking. This is a study by Douglas and Hams in 2006. Dynamic aspect of spatial memory is a cognitive process, and it is very important for maintenance of the balance. In vestibular disorders, there is poor understanding of the direction, route of the map, and poor memory of the map. There are some examples to check the cognition, about to give a knowledge of time, place, short-term recall, abstract thinking, and so on. So this test can be done with the patient. Now coming to CBT. CBT is a proven psychological treatment for managing various health conditions, including vertigo. It focuses on identifying and altering negative thoughts, patterns, and behaviors to address the impact of vertigo on daily life. A central principle of CBT is that what you believe affects your behavior and emotion. CBT also emphasizes mindfulness. It means the patient to remain in a moment rather than worrying about what might happen or has already happened, which can decrease anxiety and stress. Neuroimaging has revealed that the thoughts and actions which the patient learned in CBT literally modify the brain's neural circuits, and it is called as a neuroplasticity. We all know that balance disorder patients are not just vertigo or imbalance. They have a lot of other problems like irrational behavior, poor concentration, and forgetfulness. So in CBT, which is a talk therapy that can help to manage the problems by changing the way of a person to think and behave. So in this flow chart, first there is a situation where something happens, then in thought the situation is interpreted, then emotion, a feeling occurs as a result of the thought, and there is a behavior and action in response to the emotion. So what are the techniques of CBT? There are 4 techniques. First is psychoeducation, second is self-observation with guidance, third is recognizing and analyzing, and fourth is psychosocial element. In psychoeducation, this should begin as soon as the diagnosis is made. An important aspect of pathophysiology should be provided. In sessions, behavioral experiments and activities can also be used to explain the characteristics. Self-observation with guidance. The first step to break out the maladaptive behavioral cycles in self-observation with guidance on a physical, emotional, and psychosocial aspect. Patients should be instructed on how to recognize abnormal postural control, for example, rigid posture, visual reliance, body sway, and desensitization exercises can be used to reduce the behavior. Recognizing and analyzing, where it's recognizing and analyzing one's emotion and cognitive responses to dizziness can aid in lowering the levels of fear arousal and pessimistic thinking. Relaxation techniques can be used for this purpose. There are so many relaxation techniques. If you see on the right side, yoga, visualization, mindfulness, and all that. So diaphragmatic breathing, progressive muscle relaxation, and guided imaginary, these are the best relaxation proven techniques in the patients. Psychosocial element, like social discomfort, avoidance, and safety attitudes should be recognized and assessed. These concerns can be addressed by exposure treatment in a variety of settings with a therapist in a group sessions. Lastly, monitoring progress and tracking the symptomatic improvement. One should keep a symptom diary, which is very important. It promotes consistent recording of vertigo symptoms, their triggers, and intensity levels to monitor progressive and identify the patterns. And progress visualization, which utilizes aids to help patients to observe their progress and gain of sense of achievement, enhancing motivation and continued therapy. So there are a lot of research studies on CBT all over the world, and CBT may reduce the anxiety and depression associated with persistent dizziness and also avoid certain activities such as related head movements, and all the research studies prove that only 1-2 minutes that they are very effective. Then there is one more study about CBT, especially triple PD, a cognitive behavioral model of persistent perceptual dizziness is presented. Dizziness becomes prolonged when it is processed as a threat, and cognitive behavioral therapy is a promising treatment for triple PD. So these are the references for this topic. And lastly, I would like to conclude my session. What is important is a neuroplasticity. And there is an important statement from a great American neuroscientist, Sir Andrew Huberman. He says that neuroplasticity is the brain ability to change and adapt in response to experience. It's a powerful tool for personal growth and transformation. So thank you very much for your listening, and kindly accept my best regards. Thank you.
I request Dr. Gaurav Agrawal to hand over the certificate to Dr. Swanand Golub. Next talk, Dr. Kavita Chaudhary.